Hello, I'm Dr. Brian McDonough. A couple quick points. First of all, we just went over the 600,000 mark in deaths in the United States. I think that is essential to at least address and talk about the memory of those who died and the fact that we need to learn from this. We need to learn about the importance and the vulnerability that we all have when we have worldwide health issues. We are part of a global society. We have to understand that, and we have to realize that science and medicine don't necessarily cure everything. Given time, they can make a difference. And clearly we now have vaccines. We got to get vaccines to the rest of the world too, but these vaccines are making a difference and they are changing things. As a result of that, selfishly, I don't have to do as many of these videos. Now, I said early on that I was going to do them if there was a purpose. I got out of TV for a reason. I enjoyed it, but my time and interest in it had passed. I moved on to other things, but it was essential to continue doing videos at this point because COVID needed to be talked about. But there aren't as many major developments day to day. So what I'm morphing into is talking occasionally about key health issues and in a way how COVID has impacted them. Last week I talked about diabetes, talked about general symptoms and how if you haven't seen a doctor, it's important to get seen and make sure that you're not suffering from this condition, which can have long-term ramifications. But that report led to a lot of people responding, which I'm thankful for. And in the responses, several people brought up points that I thought were very important. And they are that people don't necessarily follow up the way they should once they have diabetes because of COVID. In other words, they were put on medications with refills. They're taking the medications believing they're controlling their blood sugar, but they're not getting blood sugar testing or they're not getting hemoglobin A1Cs. In other words, they could be in greater trouble because of side effects of the medications that they're taking because they don't even know what their blood sugars are. So if you're someone who has been diagnosed with diabetes before COVID occurred, you haven't been seeing your primary care physician or your endocrinologist, you haven't even done a telehealth visit, you should check in. Because if you haven't heard from your doctor, it doesn't mean your doctor's not worried. Your doctor's just catching up in the world they had to catch up with. So you need to take ownership. You need to make sure if you are on medication for diabetes that you follow up. Because if you're not treating yourself right, in other words, if you're not controlling it to the level you should, you could have long-term damage. Or in the alternate situation, you could overcorrect, you could get hypoglycemic, and that can lead to its problems, including your own general feelings of well-being or worse. Thanks for listening. I'll be checking in periodically. Take care.